The South Dakota Department of Health is reporting encouraging information in the fight against syphilis, with cases across all stages down over 40%. Grant Green has more on what makes syphilis so hard to identify and also how the Department of Health is making progress over the course of the last few years. The spread of syphilis in South Dakota went from just 100 cases of early syphilis in 2020 to over 1,500 cases in 2022. That figure has steadily dropped, but it's never easy to contain syphilis, as it's referred to as the master of disguise.
For the Department of Health, combating the sharp increase in cases has been an all-hands-on-deck effort.
We've partnered with our healthcare facilities, IHS, Tribal Health, Great Plains Tribal Health, public health nurses, correctional facilities like Minnehaha County Jail and Pennington County Jail, and also Department of Corrections.
Syphilis cases usually start out very small.
The first indicator of syphilis is a chancre, which is a painless sore that is typically located in places that you can't see or can't see easily. And then it goes away.
This is called primary syphilis. The next stage, if left untreated, is secondary syphilis, often marked with a skin rash, and then latent syphilis, which sometimes comes with no symptoms.
And, a lot like other illnesses, people think, if it goes away, I'm fine. But with syphilis, you still can spread easily.
If syphilis continues to be untreated, this is when serious complications will arise.
Long-term syphilis or untreated syphilis can really cause damage to the brain, heart, and nervous system.
The key to avoiding issues with syphilis is to get tested and take preventative measures.
The very first one is unprotected sex. So wearing a condom or a barrier when engaging in sexual activity is primarily the most important part.
Another way syphilis can be transmitted is through pregnancy, called congenital syphilis. The Department of Health has been able to prevent 71% of babies at risk from being born with syphilis, a form of transmission that affects indigenous populations heavily.
To learn more about the risks, symptoms, and where you can get treatment, go to the South Dakota Department of Health's website at doh.sd.gov.